Hello everyone. This video is for a brief overview of federal health care payers, as you all know as insurance companies or healthcare insurance companies. We will first start off by reviewing Medicare. The objectives of this PowerPoint will be to identify the major federal players, which is Medicare and Medicaid, understand basic coverage and benefits, review key policy, and discuss ACA's impact on payer systems. In order to be eligible for Medicare, a person has to be at least 65 years of age or older, or you have to be a person with a disability, or be in end-stage renal disease or be diagnosed with end-stage renal disease, and or hospital and medical and prescription coverage. Medicare also covers hospitalization, medical care, and prescriptions, totaling as estimates of as high as $44 million a year of coverage for individuals through Medicare. There are two parts. There's more than two parts, but the parts that we're going to be focusing for this slide is Part A and Part B. Part A of Medicare covers hospital coverage, skilled nursing care. It also is benefit that covers hospice and home health, select things within home health. So again, Part A covers your hospital care benefits for Medicare, skilled nursing benefits if needed by a member, hospice care, and or home health. Home health care, certain home health care coverage. Services under Part B include services, general healthcare services, such as prevention services. For an example, providers are reimbursed through Part B coverage. Medical supplies, maybe medical supplies for home health care needs, but the medical supplies are covered under Part B of Medicare, as well as equipment for medical care. So again, Part A covers your hospital stay coverage, your bills associated with hospital stays, inpatient care, skilled nursing facility cares, hospice and home health, and Part B are your services for healthcare, such as your prevention services. Providers are reimbursed under Part B, medical supplies and equipment. There is also Part C and Part D of Medicare. Part C covers is a private plan management of the Medicare benefits, which includes HMOs, PPOs, fee-for-service plans, special need plans, and medical savings plans are covered under Part C. When you're thinking about HMOs, those are your health maintenance organizations. That's what HMO stands for, and PPOs are preferred provider organizations. Again, so reimbursements for healthcare organizations, preferred provider organizations are paid for through Part C. You may look at your insurance card and see where you have an HMO or PPO plan. There are fee-for-service plans that are also located that are covered under Part C. Any special needs, and again, if you have a medical savings plan, that was covered through Part C. Part D is your prescription drug coverage. So think about D for drugs. So Part D is your prescription drugs, and it covers your original Medicare coverage for prescription drugs. It can also be Medicare cost plans for prescription drugs. The Medicare has specific cost plans for that. Fee-for-service plans, medical savings plans, approved insurance and private organizations plans, and some advantage provider plans are covered under Part D. So when you think of Part D, that's your prescription coverage under Medicare. Medicare covers areas of health need for persons over 65 and disabled and those with end-stage renal disease. Some of the prevention services that are covered, prevention healthcare services that are covered under Medicare includes shots, such as your flu shot, your annual flu shot, your Hep B shot. So think about your immunizations and your boosters for immunizations as well. Vaccines are also covered under the prevention category. Exams such as your well visits and screenings for HIV, cancer, pap smear, alcohol, for an example. Those type of screenings, prevention screenings, are covered. Other um, type of prevention service that are offered under Medicare includes intensive behavioral therapy, specifically for obesity or cardiovascular disease. If there's a diet change required, and what are the behavioral changes to improve your blood pressure, your heart rate, for example, diabetes self-management and training. And again, the key here is to catch things, even if they are a mild problem, before they get too far gone. So when you think about substance use screenings, that you may go to your healthcare provider and they ask you, do you drink, do you smoke, and they note that in your chart, because that will help govern what preventive care they need. Even if you smoke, doesn't mean you have cancer, but they would probably try to put you in some kind of wellness programs to help you, or smoking cessation program to help you kick the habit before it becomes a serious health problem for you. Hospitalizations are covered under Medicare, such as your general nursing service that you get in the hospital. Sometimes, in order to get a semi-private room, that coverage is covered under your Medicare. Provider services, such as the services you get through Part B, is covered. Meals and supplies that you receive in the hospital are covered under, are some of the things that are also covered under Medicare. When you think of home health, there are specific services that are covered under home health, and that's why the prior slide had the asterisk to it. And your services from an MD, a medical doctor, a certified medical doctor. Your short-term skilled care is covered. Skilled nursing, or what we call SNFs, skilled nursing facilities, are covered under home health. Physical therapy, occupational therapy, speech therapy, medical and medical social work benefits are covered. Home health aid, durable medical equipment. So all these services that you receive from your typical home health care programs is covered under Medicare as well. But it should be very important to note here that there are services that are not covered under medical care, under Medicare, and it's listed here. There's no private duty nursing. That is not covered. So if a client or a member wants to receive that benefit, they have to pay out of pocket for that. Medicare does not reimburse or cover private rooms for hospital stays. The television and phone services that you receive in the hospital is not paid for or covered under Medicare, and that could be a bill to you as a patient. There's no full-time personal care coverage under Medicare. Homemaker services generally are not covered under medical care, and these are services such as shopping, cleaning, and laundry. Home delivery is not covered, and long-term care, such as long-term care facilities for elderly people or people with severe disabilities, for example. Community care and assisted living type facilities are not covered under Medicare benefits. Medicare also has an additional Medigap policies, and these Medigap policies are additional policies or insurance plans that you can cover, that's meant to fill the gap in services not covered under Medicare. That's why it's called the gap, Medigap. And these are private health insurances, and they offer supplemental coverage options for people who need additional or supplement coverage for their health care. It helps pay for those uncovered costs of the original Medicare plan. And again, that's why it's called GAPS. It's not considered Medicare Advantage plans because it is a supplemental plan. It's something that you buy in addition to your Medicare, or you pay for in addition to. Consumers pay for Medigap policies, not Medicare. So if they want these additional supplemental policies, they pay out of pocket for that. But the Medicare, they do not have to pay for. That is covered by the government, federal government. Medigap policies primarily vary by cost, but more information on those policies and costs can be listed here at that website. There's also something known as Medicare Part D, which is, as you remember, is your prescription drug coverage called a donut hole. And it is actually a gap in amount that's covered for prescription drugs. So there is a gap in terms of there's a certain amount that's covered, and once you get to that amount, no more is covered under your prescription drug cost. Now, it's important to note that there's some Medicare beneficiaries that may never reach their gap or the point in which they stop paying the limit for costs in terms of coverage for healthcare, but a gap can occur. So a gap occurs after 3,700 total has been spent from the consumer plan on prescription drugs. There are discounts that are often offered at 40 to 49% of cost based on the type of prescription someone is getting. That's a brand name versus a generic. So oftentimes, Medicare beneficiaries are steered toward getting those generic brands so that they can are able to purchase the drug at 40 to 49% of the cost of that drug. And that means they will not reach that $3,700 expenditure quickly. It'll take them longer to reach it. And again, it should be important to note that not all consumers of Medicare reaches that 3,700 expenditure, especially at purchasing the generic drugs, prescription drugs. However, it is possible, and it is considered a donut hole because of that gap in coverage. Medicaid. Medicaid is different from Medicare in that it is for low income individuals under the age of 65. And it also calculates your modified adjusted gross income to see if you're eligible for Medicaid. And when they're considering what the coverage is and whether a family meets a threshold, they want to see where they're at least 133% of the FPNL for children. And so that's the federal poverty level. So they want to see where you're at least at 133% of the federal poverty level for children. And you also have to be a citizen of the state or qualified non-citizen with a medical need. You can also be eligible for Medicaid. So these are the areas of eligibility for Medicaid. And if you know anyone who applies for Medicaid, this is the eligibility criteria in which they will allow someone to apply for those benefits. And individuals have to meet that in order to be eligible for it. So what are some of the things that Medicaid cover? It covers inpatient stay, it covers inpatient hospital stays, it covers nursing facilities, it also covers physician costs, screenings such as for certain illnesses and ailments. Diagnostic treatment is covered under Medicaid, and also treatment is diagnostic tests and treatment. Outpatient services are also covered under Medicaid. Home health services, nurse 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 midwives are covered under Medicaid. Federally qualified health centers are covered. Costs associated with them are covered under Medicaid. Rural health clinics um, are providers or accept Medicaid as well. Laboratory x-rays, family planning, certified pediatric, and family planning with a nurse NP are also covered by Medicaid benefits. So here you can see you get a vast coverage of healthcare benefits under Medicaid plans. Optional coverage for Medicaid includes inpatient psychiatry. Optional coverage includes prescription drugs, clinical services, or clinic services, OT/PT services, speech, dental, dentures, eyeglass, optometry, hospice, and prosthetics. Those are optional coverage and usually have to get authorization to receive those type of um, those services. Talking about Medicaid, and it should be important to note here, Medicaid is different than your commercial plans, healthcare plans, and that sometimes the reimbursement to providers are not as large under Medicaid as they would with commercial plans. And so that should be clear. Um, it's oftentimes not as attractive as a payer source for some providers because of the lower reimbursement rates. However, there are some states though that will offer more money to make Medicaid recipients receive, or providers that accept Medicaid to receive just as much competitive reimbursements as if they were accepting from a commercial health plan. And again, so that varies state by state how much a provider may be reimbursed from Medicaid. And so again, just to be very clear, there are some states that are a little bit more competitive to um, um, insurance and reimbursements for providers um, as a commercial insurance company. An example for that, um, a commercial insurance company contract rates for a clinical social worker, for example, may range anywhere from $60 an hour for services to $75 an hour to services to $100 an hour for a clinical social worker. Medicaid may pay that clinical social worker $65 an hour or $69 an hour. So it's somewhere competitive. So sometimes Medicaid may pay more for that clinical social worker per hour than at least one insurance company. However, you will notice that most of the insurance companies pay a little bit more, and some a lot more than Medicaid. But just know that it tends to provider reimbursements may not be as much, and so that way a lot of providers may choose not to accept Medicaid. And so the problem with that then becomes if Medicaid beneficiaries do not receive access to full quality services because providers are not accepting those type of plans. And then the other concern about that is that someone may live in a rural area or an area where there's not a lot of Medicaid accepted providers accepted, and so they may be limited on the type of providers that they can see, and it be covered as well. So how does ACA factor in? The Affordable Care Act expanded coverage for Medicaid for those states who accepted that expansion. It made Medicaid more accessible by increasing the cost somebody could make to still be eligible. So before you would have to make a certain amount to receive Medicaid, but it expanded that coverage. So that means that you could make more money income wise and still be eligible for Medicaid. Not a whole bunch more, but more. And that was the way to expand it to cover more people. And the states decided through ACA whether they wanted to accept that expansion or not. Um, the ACA also held insurance company more accountable for cost and quality of services and equitable services, particularly related to mental health coverage. It increased choices, options for insurance plans, um, giving consumers a wider range of plans to select from. Also, ACA seeks to enhance the quality of services provided under Medicaid and lower costs of Medicaid so that recipients can comfortably afford any care related to their health care. And lower overall costs of healthcare expenditures was the goal of ACA. More information about that can be found at this website here. There's also a summary of ACA benefits. This website here should be able to take you to that summary of ACA benefits so that you're aware of it. This is a quote from Barack Obama. Change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. I believe that was his vision when he signed the Affordable Care Act into law. And so this is going to end this brief review of federal health payers and the key areas of coverage for them. So Medicare and Medicaid are the main ones. And think about the clients that you may be working with or family members you know, or if you've ever had Medicare or Medicaid benefits, and how they pan out. This is a between Medicare and Medicaid, they cover most of the health care for people over 65, and low income individuals. Medicare and Medicaid is going to play an important role, and they always have in our healthcare, but particularly related to COVID-19. If you think about the type of coverage, if they develop a vaccine, that should be covered under preventative services. If people are hospitalized under COVID-19, hospital healthcare services are covered under Medicare and Medicaid. But also, our goal here is to keep people healthy, and so there's a lot of focus on wellness related to that. And so, again, Medicare and Medicaid are going to play a huge role in keeping people um, well, keeping them managed for healthcare wise when it comes to certain illnesses, sickness, chronic disease, particularly related to COVID-19. And it also, if somebody needs additional services such as home health care services, it will help support that as well. And so I'm hoping you get into your being able to see how important these payers are in the administrative of health service, particularly to vulnerable. Think about people who are 65 and older. Elderly is considered they're considered a vulnerable population. When you think about end stage renal disease, these are people who have a chronic, very sick, very ill people considered vulnerable. The disabled covered under Medicare, um, vulnerable population. Medicaid, vulnerable populations, low income, and poor and children, particularly children who are in poverty. So the thinking is that with these coverage that healthcare coverage that focus on vulnerable populations, that we can keep those vulnerable populations well. And that's particularly important because if you think about COVID-19 specifically, we know that people who have pre-existing conditions and those who are more vulnerable from healthcare are most susceptible to that. So that also gives you implications to the role that Medicare and Medicaid can play with COVID-19 populations in general. That concludes this discussion on healthcare payers. I will also upload another PowerPoint slide that also talks more about Medicare and Medicaid coverage. Thank you.